Since none of your colleagues are here, I'm going to turn this into a sort of a one-on-one discussion, because yesterday afternoon, those of you who were here heard Dr. Barber give his presentation on how the system runs in Mexico, and I think we could find out how the system runs in Greece. So, Dr. Giacomakis, what does the law in Greece say about surrogacy? Does the law permit surrogacy?
I would say it's a very liberal law. We start with a court decision before start the program. We inform the surrogate what about taking care of her health before, during, and after pregnancy. We inform the couple for all the stages of the program. So before we start the program, everybody, I think, is enough informed.
Right. And what protection does the law give the partners? For example, if the surrogate refused to give up the child, does the law say that it's the child of the intending parent? What would happen under those circumstances?
Yes, it's very clear, because is underlined before we present to the court. It's written very clearly into the court decision that if ever she denies about the baby, very soon is clear, since of course she's not the genetically mother. She has nothing to do, because it's absolute. There is no way that she has any genetical relation with the baby. So her denies, I mean, they are
right.
With no sense.
Right. And as you probably know, there's been a lot of talk in the news media over the last year about two people who refused to accept their child and left it with the surrogate. What would happen under those circumstances if an Australian couple refused to take the baby?
Yes, I mean, everybody wishes that this never happens. Okay. So one option is if it's a healthy baby, and for some reasons intended parents they refuse. This is also predicted by the decision that they have the opportunity to give the baby for adoption.
Right.
For medical reasons, I mean, they have to do with the health of the baby. This, apart if it's written, you understand that it creates problems that they could be unpredictable, and nobody wants to go through.
Right. Okay. Once the baby is born, from what you've said, I presume it's a Greek citizen. Does it become automatically a Greek citizen when it's born?
Yes.
It does?
Yes.
So, go on. I was going to say, so it's a Greek citizen, so if a couple refused to accept the baby, it wouldn't be stateless.
Sorry, if it's not a Greek citizen.
It's not?
No, because it's registered right by the clinic into the name right from the birth, into the name of the intended parents. So the couple, we help them. They are presented into the registration desk, and with the court decision is registered directly into the name of the intended parents. Actually, from the very first beginning, is covered, according to our laws, from the health insurance of the couple.
Right.
It's a philosophy as if a foreign couple came and happened to deliver in Greece.
Right. So I mean, that presents a potential problem, because if the couple refused to accept the baby, it's not a Greek citizen, and therefore you have the problem of trying to get somebody to adopt it, don't you?
This I haven't think about, but I mean, I don't know if I don't know why a foreign couple doesn't have the possibility to give a baby to adoption.
No, right. Okay. So provided there's somebody there to adopt it. Yep. And what's the mechanism for getting the baby out of the country? The baby is the child of the Australian couple in this sense. How do they get it out of the country and back to Australia?
Yes. Here I have to tell you two predispositions, and then I tell you the procedure. Mm-hmm. One is that the Greek law, and I think the international law, protects the medical data, mm-hmm. and also protects the personality of the baby itself. So, only the registration desk could give the necessary informations to the embassy, right, of the country that it should go back, just about facts. I mean, that he has been born a baby, if it's born, not even if it's born naturally or, mm-hmm. or through cesarean, because since the registration desk has the documentation, and the registration desk informed the embassy that it will be present a couple that has all the predispositions to carry a baby out of the country. Whoever should ask, it's on the level of curiosity, or I mean, it's not that we hide something, it's that we respect something. I mean, if an authority ever should ask for information, yes, but not everybody. I mean, I don't know what's going to happen when the baby is going to get into the country, but we are sure that the baby is going to be with a visa or with a passport within 15-20 days, and they can take it back home. What has happened home? It has to do with the legislation of the country that goes back. The couple is informed, lawyers, they have been in between, but we inform them because actually we don't want any case to finish through courts and surrogacy, etc.
Got it. Thank you very much. How do you recruit your surrogates? Where do they come from?
Surrogates, they are mostly ex-patients from our unit and through obstetric and gynecology and IVF department. So we know them in advance.
And do you require that they've finished having their own children before they become surrogates?
According to the law, it's not necessary. Right. According to the law. But we insist that it's almost necessary to have at least a child for the well-known reasons. I mean, the psychological factor is less, and plus everybody should think of the rare possibility that something could happen during delivery and they should stay childless themselves.
Sure. So they should have had at least one child.
Yes.
Yeah, we have the same situation in the ACT. That's our rule as well. And how old are the surrogates? What's the age range of your surrogates?
Depends on the case.
Yeah.
I mean, if the mother carries the baby of the daughter, she can be any age, no restriction.
Right, right.
But as donors, as recipients, we would try that they don't go over 35 years old.
Right, fine, fine. That actually is very good, because I think most people in this country have surrogates up into their 40s in some occasions. But I would agree with you. I think if you can keep your surrogates relatively young.
You will know very well that actually age, to carry on a pregnancy is something relative. Everything could happen to a very young woman, and nothing could happen to an older woman. So it could be an evaluation of all parameters.
Yeah, sure. And how do you screen your surrogates? How are they screened?
Not to forget is that it's necessary to be under a psychological examination by a state psychiatrist. It's necessary to be presented into the
Is
court.
that required by the law?
By the law.
It is, right. Sorry,
Absolutely. And then we do all the possible microbiological, transmitted, genetically examinations. We check them also, all of them, for fibrocystic, for karyotype, thalassemia, apart that it's not necessary, but in order to take care of an extra care, I would say, for their health, because it would be nice to find out a heart problem which is related to a chromosome translocation, etc., and because we're going to face the problem. So apart that is not a guideline, we do all the controls in order to prevent and to protect their health.
So, and how much do they get paid? What do you pay them?
In Greece, according to the law, the programs, they're altruistic.
They are all altruistic?
They're all altruistic.
What happens in reality?
In reality is a compensation monthly into the surrogate from the moment that we are due to present to the court, because we would like them not to work, right, because most of them, they do work that they have to do with babies or maybe. So we want them when they because everything to us goes fast in a way. I mean, we get the decision of the court decision within a month, so we rather are fast to get the court decision. So we don't want them then to decide to stop work, and we want to have things under control. Yeah. So they get a compensation monthly.
Right.
And then, during the delivery, they get an extra, according to the couple, what will they want to give as a reimbursement.
I see, right. So, what does surrogacy cost in Greece? If you take that into consideration, if you take your clinic's costs, yes, the money that's paid to the surrogate, the costs of the pregnancy and the delivery, what does it cost?
As few people, they know that for some reason surrogate programs, they're a bit more complicated than all the rest, because we transfer one embryo, because I wouldn't say that nothing happens because of surrogate, but I would say that the miscarriages rate is higher than
yes.
Yes, as obstetricians, kept knowing that transferring an embryo to a different uterus, that should be even better because you eliminate the immunological factors, etc.
Yeah.
But that doesn't.
Okay, so if I'm an
Yes.
Australian couple and I come over to your clinic and I say we want to do surrogacy, from the time
Yes.
I come through the clinic door to the time I get on the plane to take the baby home, what does it cost?
I think if the program runs
Goes well.
as well, it will cost around 50,000 euros.
50,000 US?
Euros.
Euros. So that's, I mean, what are we on? There's about 60 euro cents a dollar. So, yeah, about 100,000 Australian dollars.
No, it's less.
Less.
I changed 1,000 euros to 1,350 Australian. 1,000 euros.
What is it now?
1.35.
Be 80,000 Australian. Okay, I was trying to do that mathematics. There are very few doctors who are any good at mathematics, and I'm one of them.
I got it from the bank. I told the bank.
Do the intending parents meet the surrogate?
Yes.
They do. Is there an opportunity to have an ongoing relationship, and can the child meet the surrogate in years to come?
It's a pleasure for everybody because give us, less responsibility because they take some of the responsibility. And plus, we want the couple, apart, if it's from far away, to have a close idea of the situation of the procedure. Because as we kept saying in the previous lecture,
Yes.
I mean, sometimes we have to announce a miscarriage of the 9th week or 15th week or something like that. So, think if the couple has only informations from us, and then a certain morning we announce that something went wrong. I mean, it's much better if they have a close relationship, so that they have an idea of the pregnancy itself and what happened. It happened.
Yep. Thank you. You've done very well because there was supposed to be 3 of you here and there's just you, so you've taken this grilling very well. I think we've got about 2 minutes left for questions. Any questions for Dr. Giacomakis?
Good morning. Thank you. How many of your surrogacy arrangements involve the use of egg donors, and are those egg donors identity released so that the future child, adult, has access to information?
Yes, good question. As I mentioned already twice, we try to explain into the intended parents the whole procedure till the end. We are not in a hurry. I mean, if you say, for example, I have 5 embryos somewhere and I want to carry in Greece and start the program, I won't say immediately yes. I would say, sorry, how old are you when you create the embryos? Which is the quality? What is going to happen when we don't finish? We don't get into an end with these embryos. So, if they insist that I will not proceed to a donation, I make very clear that, look, you have these possibilities. And I think we stop if you are not ready to proceed. So, even with the male factor, even with the female part, we are very clear. We try to make clear all the possibilities if we all want to come to a happy end, to a conclusion. So,
how many egg donor cycles do you do? What proportion of your program is donor eggs? Your percentage?
we are happy to have donors, and we are happy to have surrogates.
You know, do you have many donors? Do you use a lot of donor eggs? You do. And
the group is dedicated, I mean the donor is dedicated, also, although I don't know if I respond completely.
The question was, you know, do you do a lot of egg donor work? And the second question was, do the intending parents meet the egg donor? Do they know the egg donor?
No.
It's anonymous.
Donation is anonymous. But to answer to the lady, it's true that mostly of the cycles, of the programs, they end to be donated in a way, because think that till the couple discovers the problem, and according to the problem to accept it, mostly the fertility reserves are not good. I mean, if they have a hysterectomy before, we know that influences the capacity of the ovarian reserves. The age to us counts a lot. It's not such superficial as into the donation program or the conventional that it's due to finish into a donation. If we know that, I mean, we evaluate very much the fact of the ovarian capacity. So more than usual, we end to donation.
Okay, thank you very much. We've got to stick to time, so we have to leave it at that. Would you thank Dr. Giacomakis? Thank you very much.